My name is John Lignore. I'm an orthopedic clinical manager at a hospital in Connecticut. I'm very interested in orthopedics, and I'm going to go through a couple of questions with you today. What kind of physician assistant are you, and what type of training did that involve? I can tell you honestly that I was interested in orthopedics at a very young age. I studied in physical therapy. I was a physical therapy assistant, and that led me on the path towards orthopedics. I completed 4 years of college in biology and then moved on to a master's degree in physician assistant studies. Number two, can you tell us what a typical day looks like for you? A typical day in the physician assistant realm in orthopedics consists of going to the operating room and first assisting in the operating room where you get to sew and cut and participate in the surgery. We as PAs are often called as the first line when an orthopedic injury is noted in the emergency room. So we come down, we assess the patient, we determine if there's any surgical involvement. We sometimes perform the reduction, which means putting the bones in better alignment. We do the splinting, we do the casting, and we actually book the operating room and speak to the patient in detail regarding the surgical procedure. So we are, in some ways, a big liaison to the physician, the orthopedic doctor, in the plan for the surgical team as well. Number three, what made you decide to go into your field, and did you always know it was what you were meant to do? Well, like I said before, I've always been interested in orthopedics. Having the physical therapy background, I always wanted to help people, and the hands-on approach with physical therapy helped me on the road towards orthopedics. I felt that in this particular field, people get better faster, and especially in acute trauma, you can help control their pain in a much quicker way. And usually with elective surgeries, people get back to their normal activities pretty quick, and they're very appreciative to get back to where they were before. And orthopedics really allows you to treat the whole patient from a physical standpoint, but also mentally by giving them some support as well. Number four, what courses in college or high school did you find most beneficial in preparing you for your career path? Well, I really loved gross anatomy, the anatomy lab, where I get to do a lot of hands-on work, but physics and organic chemistry and biology were my favorites. I have a particular love for biology and working with animals, because we were able to dissect the anatomy and try to correlate the anatomy of animals to humans. So it was good to see the bone structure as well as ligamentous structure of different animals and compare them to the anatomy of human structure. Number five, what extracurricular activity do you participate in outside of regular coursework? So I'm a member of several different organizations. I'm a member of the AAPA, which is a national certifying organization for PAs, as well as CONAPA, Connecticut APA. In these different organizations, they provide lectures as well as online studies for the physician assistants. And as a group, we're able to log on online and talk about different problems that we have as a group and how we can better ourselves in society and how we can volunteer and help our fellow PAs as well. I also participate in a lot of lectures. I provide lectures in the hospital as far as splinting and casting and showing how to do injections. I'm always available to help with students as well. I like to give my time back because I was a student once, and I know how important that is to give back to your fellow students who are learning the same career path that they are on right now. Number six, how do you maintain focus to study and prepare for your exams and other coursework in your professional school? I always study on my own only because I want to better myself, because knowledge is power. So when I find that I don't know exactly a particular phrase or a comment made by a physician, I go back and I look up that reason or that verbiage to make sure that we're all on the same page. I want to be educated and enlightened because I also want to participate in that particular conversation. I want to be able to know how to help the patient and be an adjunct to the physician. So I'm always spending some extra time on my own, whether it's in the evening before I fall asleep or just having a conversation with my associates. Number seven, please give us any additional information about yourself, your work, or professional interests. in my current position, we streamline some processes, and especially in the operating room. We work on a budget and we try to make the PAs work together in a more efficient role. So we have two PAs in a room working while one flips the room over. What that means is, as there are two rooms working at the same time, one PA will start the case with the physician, while the other PA is closing the wound or the joint. So the doctor is actually able to go from one room to the other and not lose any time. So that improves the efficiency of the operating room. It also improves the time that the patient is in the operating room, so that everyone can work together in a fashion that's going to be more streamlined and productive to the outcome of the patient. I'd like to review what we've discussed thus far and hopefully take some points away from this video. Number one, follow your heart, believe in yourself, and know that this is something that you want to do. Whatever you want to do in life, you have to pursue it wholeheartedly. My son, who is also interested in medicine, I give him the same tools that I'm giving you today. I hope that you make that decision to follow your heart and believe in yourself. That's the most important thing. And know that as a physician assistant, you're not bound to one particular service or ideal. You can work in many different realms. You can work in the emergency room. You can work in the clinic or the office. You can work in surgery. You first assist in the operating room. So there's many different attributes of being a PA, but what works for you is what your heart tells you to do. So what I mean by that is follow your heart, believe in yourself, and go for the stars. Thank you very much for watching, and I hope you learned something from this. Good luck.